When encaging a dog, the first step is to clean, sanitize, and return bedding or food and water. Be sure to sanitize every area of the cage, including the ceiling, in between the bars, the outside of the cage, and the name card holder. The name card should be completely filled out, including name, date in, date out, description of pet, weight, procedure information, and any other important information such as shy, go slow, may bite, etc. Once the cage is set up appropriately, then you may place the animal in the back corner of the cage, preferably facing the front of the cage and on its feet. Open the cage door completely to minimize injury. Always keep a hand on the patient when the cage door is open. Slip the leash off and shut the door completely, checking that it's latched. When removing a non-aggressive dog from a cage, if there are any doors open that a patient can escape from, close them. Prepare any items needed like leash, carrier, etc. before opening the cage. Coax the pet to the front of the cage, watch for attitude changes, open the door enough to slip a hand in to put a leash on the patient. Hold the patient close to you with support of the thorax in your hand and hind end on your hip. When removing an aggressive dog, use the same steps as before, but use protective equipment such as towels and muzzles. Be sure to have a secure hold on the animal due to a heightened sense of fear or aggression. When transporting a dog from cage to exam room, lift the dog out of the cage as described previously. Carry the dog as a football to the room with a leash attached to the dog, noting potential hazards along the way. You may also walk the dog on a tight but comfortable leash. Be sure no other animals are obstructing the way. Once in the room, close the door completely. Restraint for a normal exam is as shown. Be sure to have a hold on the patient so that if they struggle, you can easily maintain control without you or the doctor being bitten. To restrain for an eye or ear exam, have the patient sit with you positioned behind to have access to the head for control. Be sure to maintain a steady hold so that the patient does not jerk away or get away from you. Be sure to completely immerse yourself in what you are doing with the patient and do not pay attention to what the doctor is doing unless asked. To apply gauze muzzle, you must select an appropriate length so that you can tie the muzzle correctly underneath the chin and behind the ears. Be sure to tighten it to not allow room for the animal to bite, but not tight enough to cause discomfort. When applying a nylon muzzle, select the appropriate size muzzle to allow breathing but no ability to bite. Place the muzzle on swiftly and clasp behind the ears. Be sure the muzzle is tightened behind the head so that the patient cannot slip it off. A patient may need a Elizabethan collar to prevent chewing or licking at themselves when certain procedures are done, including stitching, catheter placement, etc. Be sure to select the appropriate size to ensure that the patient can't reach its mouth to any part of the body and tight enough so that the collar cannot be slipped off. Be sure to not catch the ears. For restraint of a canine patient for jugular venipuncture, have the dog sit with you behind. Hold any collars or leashes above the site for venipuncture. Hold the head tilted upward but not hyperextended. Once venipuncture is complete, hold the site to stop bleeding for an upwards of 30 seconds or more. To restrain for cephalic venipuncture, have the patient sit with you behind. Position your hand caudally to the elbow of the front leg. Extend the elbow and front leg, creating a tourniquet with your pointer finger. Rotate your pointer finger laterally. Hold the compression until the venipuncture is complete and hold pressure over site for an upwards of 30 seconds or more to stop bleeding. To restrain for saphenous venipuncture, have the patient stand with your arm around the chest to prevent forward movement, and the other arm ventrally underneath the abdomen and hips. Position your hand around the hind leg, creating a tourniquet with your fingers. Hold the compression until the venipuncture is complete and hold pressure over site for an upwards of 30 seconds or more. To obtain the respiratory rate of a dog, allow the animal to get comfortable. Watch the breaths to be sure the animal is inspiring and expiring completely. With a watch, count respiratory cycles using 15 seconds to count, then multiply by 4 and record it in the patient file. The rate for this dog was 38. To obtain temperature, be sure you have all necessary supplies first. Open the thermometer from its sanitized container. Apply a water-soluble lubricant. Lift the tail completely and gently insert the thermometer far enough to get an accurate reading or enough to cover the probe. Once finished, clean the thermometer and return it to its specified place and record in patient file. Temperature of this dog was 102. To obtain the pulse of a dog, auscultate the heart. Count for 15 seconds every beat that you hear, then multiply by 4. This number is the pulse rate. Record this in the patient file. You can also use a femoral pulse as well. This heart rate was 170 beats per minute. For capillary refill time, assess the patient's temperament to ensure safety with dealing with the mouth. Slightly lift the lip on either side, revealing the gums. Depress the gums until white with moderate pressure from one finger. Release pressure and count seconds to return to normal. This patient was pink with a CRT of 1. Record this in the patient file. In order to determine hydration status, you can feel the gums, look at the eye mucosal membranes, and do a skin pinch test. Record the patient's gum hydration status since it was determined with a CRT. This patient was moist. Also pinch in between the shoulder blades and lift the skin into a tent. The skin returned to normal on this patient within a second, therefore it was determined to have a dehydration percentage of less than 5%. For assessment of femoral pulse, place fingertips along the medial aspect of the animal's thigh directly caudal to the hip joint, midway toward the knee. Once locating pulse in both hind legs, auscultate the heart and compare pulse. The rate on this dog was strong and synchronized. The heart rate and pulse rate was 170 beats per minute. To obtain pulse rate or heartbeat, count for 15 seconds, then multiply by 4. Record this in the patient file. For confirming gender, observe the temperament of the animal before approaching. Stroke from head along spine to hind end. Firmly grasp the tail to expose anus and genitalia. Observe their shape and determine anogenital distance. Next, palpate caudo-ventral abdomen wall for prepuce and scrotum for testicles. Record findings as signalment for compared results. This dog is a female. For a microchip scan, test the microchip scanner for proper functioning. Approach the animal cautiously, use one hand to turn on and operate the scanner. Scan entire body for microchip. Listen for an audible beep or alarm notifying for microchip. Record the microchip number in the patient file if the patient has one. This patient does not. For an intramuscular injection, be sure to have the correct patient, file, drug, and dose. Have the animal properly restrained. Select the proper site for administration. Do not create a tent in the fold of skin, but palpate and visually find an area of muscle without nerves. Clean the site if applicable. Insert the needle into the muscle. Next, retract the syringe and check the needle hub for blood or air. If blood is noted, change the needle hub and start over in another location. Administer the injection, check for bleeding or leakage, and record in the chart. To administer a tablet by hand pilling, open the mouth wide enough to place the tablet far back on the base of the tongue. Hold the muzzle closed, blow on the nose to induce swallowing. Once swallowed, watch the animal to be sure the pill was swallowed, or reopen the mouth to check. For an intradermal injection, do not create a tent in a fold of skin, but visually find an area of dermis, clean, and clip the site if applicable. Hold the skin taut and insert the needle into the dermis bevel side up at a 45-degree angle. Retract the syringe and check needle hub for blood or air. If blood is noted, change the needle hub and start over. Administer the injection, check for bleeding or leakage, and record in the chart. To express canine anal sacs, there are two techniques, internal and external. To perform the internal technique, insert a gloved, lubed pointer finger into the anus between 7 and 8 o'clock and 4 and 5 o'clock, with the thumb on the outer skin of the portion of the anus. Gently force the contents of the anal sac into a paper towel. Once finished expressing both anal glands, clean the animal. The excretions were brown and watery with no pus or blood. To express the anal sacs externally, position thumb and pointer finger laterally around the anus. Position paper towel over anus and push deeply and upwards towards the medial anus in a semicircular fashion. Once you are finished, clean the animal. To clip the nails of a dog, select the appropriate style and size of trimmers for the patient. Have an assistant help if necessary. Apply light pressure to the foot pad to avert the nail. Place trimmers in the proper position, being aware of the quick. If bleeding occurs, apply pressure or a cauterizing agent.